That's funny. I just noticed in my last video I had my shirt open. I was wondering. I was thinking, why do liberals have to be 100% liberal, and left-wing liberals, and why do right-wing conservatives have to be 100% conservative? I mean, I'm looking at the debate over this health care bill, and I'm wondering. I was listening to NBC's Meet the Press on my iPod, and I was just wondering, why not get decent tort reform? I mean, I believe that if a doctor does screw up by negligence, he should pay out. I mean, there should be punishment. But there are a lot of lawyers who do make it very difficult. Because people say, like, oh, if you don't give me this procedure or that procedure, I'm going to sue. And some get procedures that aren't necessary. And that's one of the key Republican points. And I believe, why not? Why not? Because just like big tobacco and gun manufacturers and insurance companies put a lot of money into the Republicans as well as some of the Democrats, the trial lawyers put a lot of money in the Democrats. And well, I believe if you can find corruption, if you can find incompetence, if you can find negligence, that is okay. But I mean, a lot of people, there needs to be some reform. But the Democrats don't want that. And another thing is interstate competition. I mean, like I read articles. I listen to the news, and I mean, I listen to Dement, which I'm not a big fan of, on a lot of issues. But I do agree with him and some of the others who say that there should be interstate competition. And I read that Bill O'Reilly said that, I mean, there are certain different state insurance companies have different regulations, so it can't really be uniform. I mean, what the regulations for an insurance company in the state of Massachusetts would be different than, let's say, the state of South Carolina. And Bill O'Reilly said then federal law should supersede, and I'm paraphrasing here, make it kind of uniform so that you can do that. And I kind of agree with him on that. And I mean, that would be more competition, because I mean, some states only have a monopoly of like one insurance company. And I believe that the Democrats just say, yes, we'll put these two things, but you have to give us some more federal oversight. That there will be that there won't be you won't be denied because of pre-existing conditions. You won't be believe that you're fully covered when you really aren't. And when you get sick, you will be dropped from your insurance. And we get to the sticky public option thing. I believe that we should have a strong government to counterbalance the business that can kind of get corrupt. But I believe we all should have free enterprise. I do believe in free enterprise. But if they get corrupt, if they get greedy, if they cut corners, if they look for ways to drop people, if they look for ways to hurt the common man, then the government should step in. That's why I'm for the trigger. I'm for the trigger. And that give them, I'd like it more 2.5 years than 5 years. I still think 5 years might be a little too long. There might be a lot of people who will die in the meantime. but give it that, and if the insurance companies cannot make those reforms, like have a couple benchmarks, then the public option will come into play, but only then. But still, a lot of people are saying, a lot of conservative Republicans are saying the trigger is a non-starter. And maybe the moderates and are going back and forth trying to make this a bipartisan deal. But then you have the Joe Wilsons, and you have the more conservatives who, sometimes I don't know what to believe. I hear from one source that in order to get in the public option, you have to have a state ID, a driver's license, or you'd have to have something that proves you're a United States citizen. But then I heard another, that a congressman from California said that they tried to put in something that would make it so illegal immigrants won't get it. Personally, call me a bleeding heart, but it's healthcare. I don't see what the big hubbub about illegal immigrants is. It's compassion. Yes, they should come here through the legal channels. But the sad thing is, when they get sick, when they get injured, whatever, they go to the emergency room and they're treated anyway, at more cost to the taxpayer dollar. And so then I'm thinking, one, it makes perfect compassionate sense. And two, it's a Christian thing to do. It's the Christian thing to do. I wonder if the illegal alien is the Samaritan of our times. I wonder. They're as despised. I don't know. All I know is that there's a fear and a lack of compassion. All I know is that we have people who have an almost pathological fear of government, but an overwhelming faith in men and in free markets, in business, in the dollar. And I believe that the government with good people in it, good men and women, living by the Judeo-Christian values of justice, of mercy, of faith. And yes, there is hard work. And there are a lot of people who are, it's not like people are just lazy bums and just, give me money, give me work. There are some of it. But come on. A lot of illegal immigrants are more hardworking than I am. They do jobs that we don't want to do. And I know some of them are, there might be some, but, and just, all I'm saying is healthcare should be a right, not a privilege. And when you have the opportunity to help insure everybody, and you don't, there's something wrong here. Obama should try to reach more and try to put those two things toward reform, but the Republicans should work too.